This year, Fox 13 is teaming up with IASIS Healthcare to help you with everyday health questions. And Carrie Cronk is with a doctor with Davis Hospital and Medical Center with more on some women's health options. Carrie?
Max, I know exactly what you were struggling over. I've been struggling in here. Dr. Arogyasami.
That's exactly.
Okay, thank you so much for joining us. And yes, we're talking about birth control, which is one of those things. Women have a lot of options, but choosing the right one. How do you take into consideration their personal needs, or what do you tell your patients?
Well, I usually ask them to think about what their plans are for childbearing. If they're thinking in the next few years, that's different than if they're thinking never again, or if it's going to be many years before they have another child. And also to think about whether they want to do something hormonal or non-hormonal for birth control.
Tell us some of the options that are out there and some of the best options you think that women should certainly take into consideration and possibly talk to their doctor about.
Well, I think especially hormonal options are the ones to talk to your doctor about because they need to be prescribed by your doctor. So things to think about are your current health. If you have high blood pressure, if you're a smoker, then your options are different because you shouldn't take something with estrogen in it. Also, if you're thinking it's going to be 3 to 5 years or more before you have another child, then long-acting reversible options like an IUD or an implant in the arm are really great because you don't have to think about them every day or every week or every month.
Are there some methods of birth control that may actually inhibit pregnancy even when you're finished with the birth control, so you want to take that into account?
Most forms of birth control have a very quick return to fertility. Some forms like the injectable progesterone or medroxyprogesterone is what it's known as, can for many months afterwards inhibit ovulation.
Okay, good information, and I know some of you at home still have questions, and that's the whole purpose of today. This is Health Fix with IASIS, and we have experts here answering phone calls. So all you have to do is call 1-844-744-3258. They'll be happy to answer your questions, and they're here until 6 p.m. Max, back to you.
They know their stuff. Thanks a lot, Carrie.